Today we will study intercostal nerve. Intercostal nerve is nothing but the ventral rami of their respective spinal segment. Here you can see this is the transverse section of the spinal cord. This is the ventral root on the anterior aspect, and the posterior aspect, this is the dorsal root. And this one is dorsal root ganglia, both unite to form spinal nerve. And then it bifurcates. Posteriorly it is dorsal rami, and anteriorly this is ventral rami. Here we can see this is the posterior aspect and this is the anterior aspect. This dorsal rami is very short, going to the skin and muscle of the back, whereas the ventral rami is very long, traverses the intercostal space and comes anteriorly by the side of sternum. And this one is known as the intercostal nerve in the intercostal area. That is the from T1 to T12 in the thoracic area. The intercostal nerve divided into two categories, that is the typical and atypical. Typical 3 to 6. Typical nerve. Okay. And for nerve and for Nargis Fakhri. She is an actress and she is 36-year-old. So how you can memorize the typical nerve is 3 to 6. Why they are known as typical? Because they are serving the intercostal space. Suppose third intercostal nerve supply the third intercostal area. They are restricted to their own place, whereas the atypical ones, besides serving its own area, it also serves other areas as well. Like this one, first intercostal nerve, it take part in the T1, it is also known as T1, and it also take part in the ventral rami, take part in the formation of brachial plexus. Whereas the second, it is also known as intercostobrachial nerve, and as its name itself says, it supply the medial side of the arm, the skin over there. And the 7 to 12, they are supplying the anterior abdominal wall, their muscles, their skin, as well as the parietal peritoneum. Now coming to the course and relation of the intercostal nerve. Here you can see this is the intercostal nerve in yellow color. Coming out, here lies the spinal cord. This is the vertebral foramen. This one is the vertebra, and this one is vertebral foramen where the spinal cord resides, which give rise to root, the ventral and the dorsal root unite to form a spinal nerve, and this one is the ventral rami. Okay, and this is a spinal nerve which is coming out through the intervertebral foramen, and then it bifurcates into two. That is this one is ventral rami and this one is dorsal rami. Okay, now this we are discussing about this ventral rami, which is also known as intercostal nerve in the area of thoracic region. Okay, so this nearby up to the posterior angle, this is known as the paravertebral space. So in the relation here we have to discuss the relation. We all know in the thoracic wall there are three layers of muscles, that is the external, internal intercostal, external intercostal. They are two brothers, and the third layer is comprises of the three sisters, that is from anterior to posterior. It is sternocostalis, then innermost intercostal and subcostalis, but it ends at the posterior angle. Okay, so after posterior angle, here is the parietal pleura. So anterior to the intercostal nerve in the paravertebral space, it is parietal pleura, and the posteriorly this green color, this is become membranous. The second layer on the posterior aspect, that is the internal intercostal, and the posterior aspect become membranous and known as posterior intercostal membrane or internal intercostal membrane in green color. So it comes into the posterior relation in the paravertebral space. Now coming to the intercostal space, we all know that the in between the second and third layer there lies the neurovascular plane, and the rib has got costal groove near its lower border on the inner aspect, and it is the inferior most structure. The relation from above downward is band, that is the intercostal vein, intercostal artery, and then intercostal nerve. So in the intercostal space, it runs in between the second and third layer, in the costal groove, and in lowermost position. Okay, so this is the intercostal nerve, and it comes out anteriorly and giving rise to various branches. Now come to the branches of intercostal nerve. हम लोग को एक सर पढ़ाते थे, आलम सर, ठीक है, वो बहुत स्ट्रिक्ट थे, इसलिए हम लोग बोलते थे कर्नल आलम. What is the spelling of colonel? It is colonel, COLONEL, spelling of colonel. So colonelalam.com. Because you usually ask one question, a pet question, that tell me what is the intercostal nerve. So intercostal nerve is nothing but the ventral rami of their respective spinal segment. Okay. So the kernel alam. Kernel is for collateral branch. Here you can see this one, the second one. First one is the main nerve, and the second one is the collateral branch. Here you can see the collateral branch, which is the muscular branch, motor to the muscle and sensory to the pleura and periosteum, but not the skin. Run in the neurovascular plane just above the rib. Okay, and the other ones are the anterior cutaneous nerve, this one, which by the side of sternum pierces deep fossa and comes out anteriorly, pierces deep fossa as well as the two muscle, that is internal intercostal muscle and external intercostal membrane. Okay, and it comes out anteriorly and give rise to medial and lateral branches. Where is the lateral cutaneous nerve? It in the mid axillary line. The main nerve pierces the deep fossa. Here in circular form, this denotes that it piercing deep fossa, pierces deep fossa, and also the two muscle, that is the internal and the external intercostal muscle, and give rise to cutaneous branch, that is the lateral cutaneous branch, which bifurcate into two, the anterior and the posterior. And this anterior one anastomose with the lateral branch of the anterior cutaneous nerve, and posterior one anastomose with the lateral branch of the dorsal rami. Okay, and these are the muscular branches, here not shown, but here this is small and small one. These are the muscular branches going to the muscles of the thoracic region. And the communicating branch, here you can see, this is not shown in this picture. Here these are communicated to the sympathetic trunk via the white and gray rami communicants. So these are the communicating branch, as well as with other intercostal nerve there are many communicating branches. Okay, now come to clinical significance. Cheaters are usually nervous. Here the nervous stand for nerve. We are discussing about this will give clue that we are talking about the nerve, intercostal nerve, and cheaters are usually nervous. Here you can see in this pic. So cheater, CHITR, cheater, that is the cold abscess, herpes zoster, intercostal nerve block, thoracotomy, and the root pain. First one is the cold abscess, which occurs due to the tuberculosis of vertebra, in which the tubercular pus will trickle, and it takes the pathway. Here you can see the tuberculosis of the vertebra. The pus will trickle down along the course of the intercostal nerve, and it comes out on this over the skin, the pus, by the side of the mid axillary line with the lateral cutaneous branch, and just by the side of the sternum with the anterior cutaneous branch, and also by the side of the erector spinae, lateral to the erector spinae muscle, which is the paravertebral muscle. And second one is the herpes zoster, in which there is herpes zoster infection of the dorsal root ganglia, and it will reflect to the specific dermatome. The dermatome is what? The skin supplied by a single spinal nerve. So along the distribution, intercostal nerve distribution, there will be extreme pain due to the upper zoster infection of the dorsal root ganglia of thoracic region. Then comes the intercostal nerve block. For the surgery in the intercostal areas in the thorax, we does intercostal nerve block, and the site will be just lateral to the vertebra, so that both the collateral as well as the main trunk both will be paralyzed. Okay, both will be anesthetized, because collateral branch also gives muscular branch. So the pain and the muscle atony will be there, for which is suitable for the operation, and also the cutaneous branch, so the pain will not reflect. So the main area to for the nerve block is just lateral to the vertebra, before the collateral branch arises. Otherwise, the pain will reflect to the intercostal areas. Okay. Now the other one is thoracotomy, in which we enter inside the thoracic cavity through a hole, and it is done in the 6th intercostal space, and we does at the level of upper border of the rib. Okay, upper border of the rib, because we know that the neurovascular bundle lies near about the lower border, because the near the lower border there is costal groove which loses this band structure. Okay, so the favorable site for the thoracotomy is just above the rib, not below the rib. And the last one is the root pain. When there is irritation of the, suppose there is infection of vertebra, and it will irritate the spinal nerve and the rami, so the pain sensation will refer to the cutaneous areas, that is the lateral cutaneous area and the anterior cutaneous areas. That is known as the root pain or girdle pain. Thank you.